What is Lewy body dementia? How is it similar or different than Alzheimer's disease and other dementias? Well, stay tuned to find out in this week's episode. Welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Dr. Melissa Batchelor, and I am a nurse and a nurse practitioner, and I've been taking care of older adults and their families for over 25 years. And before we dive into today's topic, I wanted to share a few of the different ways that you can connect with me. First, you can subscribe to the podcast if you haven't already in whatever platform you've joined. And if you like the episode, you can leave a comment, leave a review, share it with someone that it might be helpful for. That always helps to get the word out to more people. You could also go to my website, melissabphd.com, and sign up to be part of my newsletter to get the latest news and information about courses that I'm developing, as well as the AgeWiseU membership site, where I will be launching that late March of 2024. And that's where I'm going to organize all of my podcast episodes by topic so that you can find the podcasts that relate in a little bit easier place. And you can also join my Facebook group. It's the same name as the podcast. So This is Getting Old, Moving Towards an Age-Friendly World. And I will see you there. So with Lewy body dementia, the hallmark brain changes that happen are caused by abnormal protein deposits in the brain called Lewy bodies. And these deposits lead to chemical changes and death of brain cells, and it results in problems with movement, balance, thinking, behavior, and mood. But one distinctive characteristic about this disease is the fluctuation in cognitive ability. And so these fluctuations make it really difficult to identify whether or not a person's in early, middle, or late stages of the disease. So some of the symptoms, Lewy body dementia impairs memory and it causes confusion, just like the other forms of dementia. So that's one of the first things that you will see. But it also has a some very distinct symptoms that include erratic body movements, sleep disorders, hallucinations, and dizziness. So it typically happens in people who are over 50, and it accounts for about 30% of dementias. A person living with Lewy body dementia will also have, they can have auditory hallucinations, meaning that they think that they are hearing something, or 80% of them are going to experience very vivid, well-formed visual hallucinations, which means they're going to have a very clear story about seeing something that nobody else can see. And they can actually see an object and it can actually transform into something completely different, or they may see a person who isn't there, both of which can be very frightening to that person, or they can be good. It just depends on if they're seeing bunny rabbits or they're seeing bugs crawling on them. So if a person has visual hallucinations or auditory hallucinations that don't really seem to upset or scare the person, we typically don't do very much about that. But if it is upsetting them and scaring them, then we do have to intervene, typically with a medication. But also make sure that the person has on their glasses and their hearing aids if they have those, because sometimes visual impairments, people will see things and that can show up like a visual hallucination. So making sure glasses and hearing aids are in. And the hallucination could be a smell or an imagined touch. So Lewy body dementia also impacts the autonomic nervous system, and that's the part of the nervous system that regulates our heartbeat and our breathing. So it can lead to other symptoms like changes in their blood pressure or being very sensitive to cold or heat, or they could lose their ability to smell. Some of the causes of Lewy body dementia, we really don't know what causes most dementias, but basically what happens in the brain is that there's an abnormal clumping of a protein called alpha-synuclein, and that accumulates in the areas of the brain that are involved with thinking, memory, and movement. And those clumps are called Lewy bodies. So they interfere with the production of two neurotransmitters, dopamine and acetylcholine. So neurotransmitters are chemical substances they're at the end of a nerve fiber in the brain, and it relays information to another nerve fiber. So they carry these messages across this space called a synapse. So to go from one nerve to the next, or from your muscles or to a gland cell. And then those messages help you move your arms and legs, feel sensations, keep your heart beating, take in and respond to all the information that your body receives from your environment and other internal parts of your body. So this buildup of Lewy bodies leads to problems with muscle movements, memory, thinking, and processing information. So diagnosing Lewy body dementia can be really difficult because the symptoms often appear to be related to Alzheimer's disease or Parkinson's disease, but they could also be a psychiatric illness. So again, we've talked about before that getting to any dementia diagnosis means we have to rule everything else out. And then you, on top of that, have to add that maybe they have like a mixed dementia, meaning they would have a Lewy body dementia with another form like vascular dementia. So it's going to take a team of specialists, including your primary care provider, maybe a neurologist, a geriatric psychiatrist, neuropsychiatrist, and time to get to a diagnosis. But it's typically based on the same cognitive test to evaluate thinking and memory that we do with Alzheimer's disease. We may do what we need to do: brain scans, do blood tests, and sleep studies to rule out any other health condition that we might be able to reverse or treat. But once the person is diagnosed with Lewy body dementia, they tend to live 5 to 8 years on average, but they can live as little as 2 years or as long as 20 years from that time of diagnosis. And so how fast their symptoms develop and change, it really depends on that person's age, their symptoms, and their overall health. So if you were pretty healthy when you're diagnosed, you might end up living longer, but if you were already really frail, probably not so much. So let's talk about the different stages. And we've talked about this before. I tend to group all the dementias by early, middle, and late, but we'll talk about these different stages and how it shows up with Lewy body dementia. And I mentioned earlier that one of the hallmarks of this disease is the fluctuation in cognitive functioning. So this condition, unlike the other dementias, doesn't always progress in a predictable pattern of decline. So they can have very unpredictable swings that make it feel like the person is moving maybe back and forth between the stages, but they're happening within the stage. And so this means the person may be able to perform daily tasks well one day and then be disengaged with a profound loss of memory the next day. So you may recall with the episode that I just did on Parkinson's disease dementia, that Lewy body dementia and Parkinson's disease dementia look very similar in the motor changes that happen. So we're going to see a lot of rigidity, falls, changes in the way the person walks. But a person with Lewy body dementia is going to have memory loss from the very beginning. And a person who has Parkinson's disease dementia is going to have Parkinson's disease first, and they're not going to develop the memory changes until nearly a decade after kind of the motor issues have started. So if you've been diagnosed with Parkinson's and a year later you end up having memory changes, you most likely really have Lewy body dementia. So in early stage Lewy body dementia, unlike Alzheimer's disease, the memory is going to still be intact in the early stages of Lewy body dementia, but there'll be some confusion and some mild cognitive changes that might be present. So this means their long-term memory is probably going to be intact, but their short-term memory is going to be impacted. And they may have varying attention spans during the day, meaning they're drowsy and could take long naps during the day, or they could sit there and have really long periods of just kind of staring off into space. In general, the earlier stages of Lewy body dementia involve hallucinations or other distortions of reality, such as delusions. And a delusion is believing that you can do something that you can't. When someone says to you, "Oh, I can totally live alone," and you're like, "No, I don't think you can," or "I can go back home." So those types of things, it's a distortion and a lack of insight into their actual true ability. But they can also have restlessness or acting out in their dreams when they're sleeping. And this is called REM sleep behavior disorder. And what that means is that while that person's sleeping, they may punch, kick, scream, yell, and have a lot of behaviors when they're actually asleep. Because Lewy body dementia also impacts the nervous system that controls our automatic functions to be impacted, there could be issues with blood pressure control, heart rate control, sweating, digestive issues. It can result in a sudden drop in blood pressure when the person stands up. So that means that they, stand up, they get really dizzy, and that could cause them to fall. And there also could be issues related to their bowel and bladder control. So with their bowel, they could have constipation, or they might develop urinary urgency, which is when as soon as you got to go your brain tells you it's time to go to the bathroom, and they have to go to the bathroom like right away. So it reminds me of that commercial, gotta go right now. But they could become incontinent or and that incontinence would be like an urge incontinence because they have that urge to go to the bathroom and they don't get there in time. So moving on to the middle stage, as Lewy body dementia progresses, the person's cognitive ability continues to decline and their attention span gets smaller and confusion increases. So at this point, the symptoms might include a problem with motor function. And that so the person may fall, they could lose their ability to wash themselves in the shower or dress themselves. And these particular symptoms are also what we see in Parkinson's disease, but um, so there's also going to be more difficulty with talking. They may develop swallowing problems, or their paranoia or delusions may get worse. In the later stages of Lewy body dementia, these are characterized by extreme muscle rigidity and sensitivity to touch. So you may lightly touch them. It's almost like one of my cats during the day. If I just touch her, she recoils like she's on fire when or I'm on fire when I touch her. But at night, she's so cuddly. But that's a sensitivity to touch. People will also need assistance with almost all of their activities of daily living, including eating and bathing. Speech, at this point, they actually may only be able to whisper, and some people just stop talking altogether. For treatment, just like with other dementias, there's not a cure for Lewy body dementia, but the treatments that we use are just really to improve the symptoms for a period of time. So one medication that's used for Alzheimer's disease is also used for Lewy body dementia, and those are called cholinesterase inhibitors, and they may help the person's cognitive ability for a while, but most of the cholinesterase inhibitors are actually used to preserve function. So while they're not really helping the person with their thinking as much, they are going to allow that person to be involved in their own self-care for a much longer period of time until it's at a point where they're dependent. And at that point in time, it's probably a good idea just to stop the cholinesterase inhibitor because it's not going to do anything. So other medications can be used to manage the movement problems and the sleep issues. And then other therapies include things as like simplifying their environment and creating a daily routine might be helpful. So typically working with PT, OT, or speech is where you're going to want to go once you get to a diagnosis based on the symptoms you're seeing at that time, and kind of using your care team to figure out what you need to be doing at any point in time. So you can learn more about Lewy body dementia from the Alzheimer's Association website at alz.org. You can also check out my other episode on Dementia 101. I briefly go over the most common types of dementia, and these episodes are a deeper dive. You can find them on my website, melissabphd.com, and you can find out more information there about how dementia is diagnosed and find other resources if you or someone that you love is concerned about your memory. So thank you very much for listening today. I hope this has been helpful information for you. And don't forget to connect with me by subscribing to the podcast and leaving a comment, liking the episode, and sharing it with someone that it might be beneficial for. You can also visit my website, melissabphd.com, and sign up to be part of my weekly newsletter. And don't forget to join the Facebook group called This is Getting Old, Moving Towards an Age-Friendly World. And I look forward to connecting to you there. Until next time.